Hi, my name is Jill Tomlinson and I'm a plastic surgeon who specialises in hand surgery treatment. In this video, I'll go through the treatment options for adults who have trigger finger and trigger thumb. If you've been sent a link to this video by my office, it's because either you or your doctor have advised my clinic staff that you have trigger finger or trigger thumb. Occasionally, we'll discover through this video or when I see you that you don't have trigger thumb or trigger finger and that your symptoms are due to something else. However, in this video, I'll explain what the condition is and the recommended non-surgical and surgical treatments. While the decision on what treatment you have is ultimately one that we should confirm together after a discussion and after I examine your hands, the information in this video is designed to assist you in understanding your treatment options and deciding which treatment you prefer and is a good choice for you. People who have trigger thumb or trigger finger tend to report problems of stiffness and in flexing and extending the affected fingers or thumbs. It's particularly worse in the morning, and there's often pain, clicking, and in more severe cases, locking of the finger. That's when you go to bend your hand and your finger gets stuck, so you need to use the assistance of your other finger or something else to straighten it out. The symptoms tend to be worse in the morning because our hands swell up when we sleep. And when I see you, I'll be keen to work out which of your fingers and thumbs are affected. Sometimes it's only one, sometimes it's multiple. So what is trigger finger or trigger thumb? Well, the problem underlying it is that you develop a nodule in one of the flexor tendons. That nodule means that the tendon is then too big to pass easily through the sheaths and pulleys that stabilise the tendons against the bone. If the nodule's not too big or the nodule's not too tight, then you mostly notice stiffness and some difficulty with moving. But if you have clicking or locking, that's because the nodule is getting stuck when the tendon moves back and forth. If your thumb is stuck out straight and you can't actually flex that joint at all, it's because the nodule is simply too big to move underneath the pulley. The analogy I use is that it's like the Montague Street Bridge, which is a famously low bridge in Melbourne that captures trucks every once in a while. Surgical treatment, if it's needed, is to open up the bridge to let the nodule pass through, like bridges that open to let ships through. Often there's no clear reason that people develop trigger finger or trigger thumb. But there are risk factors, and they include overuse, trauma, diabetes, carpal tunnel, and being female. Trigger finger can actually be given a grade of severity ranging from 1 being least severe to 4 being most severe. With grade 1, you just have some stiffness and perhaps some tenderness in the area that's affected. With grade 2, there's some catching of the finger when it moves. Grade 3 is when the finger locks and you need to straighten it out. Grade 4 is when the digit is actually either stuck straight or flexed and you can't move it through its normal range of movement. The treatment options for trigger finger and trigger thumb include non-surgical options and surgical options. Both aim to cure the condition. The non-surgical options range in effectiveness in different studies from 40% to 90%. They include activity modification, taking non-steroidal anti-inflammatories such as ibuprofen, seeing a hand therapist for treatment including splints, and having a cortisone injection to the affected digits. If non-surgical treatment is not effective in you, it's reassuring to know that surgical treatment is highly effective. It's performed as day case surgery in hospital, and it can be performed under local anaesthetic, or you can have sedation if you prefer to be asleep for the operation, as many people do. If you're wondering whether non-surgical treatment will be effective for you, more likely than not it will be. In most instances, non-surgical treatment will work. It's more likely to work if you've only recently developed trigger finger or trigger thumb, and it's more effective for trigger thumb than for trigger finger. It's less likely to work if you have severe triggering, so if your finger's getting stuck and locked down, if you have multiple fingers that are affected, and if you're a diabetic and you use insulin to control your diabetes. What are the risks of a cortisone injection? Pain, discomfort, swelling, and bruising. Practically speaking, the most likely meaningful complication for people having a cortisone injection only affects people who are diabetic or who have impaired glucose tolerance. And the issue is that it's going to put your blood sugar levels up for about 2 days. The potential risks of having a cortisone injection for trigger finger, and I should note I've never seen these risks play out in my clinical practice, include tendon rupture, infection, which could potentially involve a hospital admission or surgery, reduced pigmentation at the site of the skin overlying the injection, and fat atrophy at the site of the injection. Reassuringly, a review of 11 studies on steroid injections in trigger digits revealed no serious adverse side effects in 1,246 digits, so it's not likely that you'll have problems resulting from a cortisone injection. What are the possibilities after you have a cortisone injection? Well, I recommend that after that first injection, you schedule an appointment to see me 8 weeks down the track. If you have no triggering symptoms whatsoever in the lead up to that second appointment, then you can cancel it because you're better. If you have a decent amount of improvement from the injection, but you've still got symptoms that you'd like to have gone, then I recommend attending that 8-week appointment so that I can administer a second injection with the aim of completely relieving your symptoms. If you haven't experienced any significant improvement from the cortisone injection, that's uncommon, and rather than suggest a second injection, I'm more likely to recommend that you have surgery. So keep the appointment and we'll discuss the options. But if it's not improved significantly after a first injection, then surgery is probably going to be a simpler way of fixing things for you. To present that information slightly differently, if after the first injection your symptoms are completely resolved, then you can cancel the 8-week appointment because you don't need to come back to see me. If your symptoms have mostly resolved, but not completely resolved, then I recommend that you keep that 8-week appointment, and when I see you, I will recommend a second injection and give you that second injection. If your symptoms really haven't improved at all, or not enough for you to feel confident that a second injection would be worthwhile, then it's appropriate to proceed with surgery. You can do that either by returning to see me at the 8-week mark so we can discuss the surgery in further detail, or if you have received sufficient information about the surgery at that first appointment, you can contact my staff to book the surgery through them. What does the process of surgery involve? Well, it's a day case operation in hospital. It can be done under local anaesthetic alone, or you can have sedation for the procedure, so you don't have to be awake. You'll have a bandage on your hand for 1 week after the surgery, and I usually will review you at 1 week after surgery and at 8 weeks after surgery. Those appointments can be via video consultation. In terms of the recovery after surgery, if we separate it out into 5 separate things: sensation, dressings, movement, skin, and pressure. As far as the sensation of your digit is concerned, once the local anaesthetic wears off, that's usually normal from then. As far as dressings go, you'll have a bandage on your hand for 1 week. When it comes to movement, so movement is permitted and encouraged after surgery. You may find that your body makes firm scar tissue at the site of the surgery on the inside as well as on the skin. If you make adhesions on the inside, then you may find for 2 to 3 months after surgery that your movement still feels restricted and that it frees up after you do exercises, but keeps going in a cycle where when your hands are still, particularly overnight, it gets stiff again. That will settle. In terms of the skin, you'll have absorbable stitches that usually fall out after about 2 to 3 weeks. Scar sensitivity can happen, and that's usually managed by massaging the scar and allowing time and massage to settle things down. Occasionally, I'll refer people to a hand therapist for assistance with desensitization of the scar. When it comes to pressure on the area, if you can't avoid having pressure on the area, you'll likely find that for at least 2 to 4 weeks after surgery, that pressure on the area is a problem for you. Most people, though, are able to adjust their pattern of hand use so that whether it's a instrument or a shopping bag, so that you're not having the pressure directly on that site in your hand. What are the potential risks of surgery? Well, the risks are very low, but they can include nerve injury, bowstringing of the tendon, delayed wound healing or the wound splitting open a little bit, scar tenderness, infection of the wound, a reaction against the dissolvable stitches, persistent contracture of the PIP joint. So if you come in to see me with a joint that's got a contracture to it, the surgery won't guarantee to fix that. And failure to relieve symptoms of stiffness of the hands. That's particularly the case if your stiffness of your hands is due to an underlying condition like osteoarthritis or diabetic chiroarthropathy. If the stiffness of your hands is not due to trigger fingers, then trigger finger surgery is not likely to affix that. While it's sensible to avoid surgery, except where you have to have it, surgical treatment for trigger finger and trigger thumb tends to be highly successful. If you have trigger finger or trigger thumb in the early stages, a cortisone injection is highly recommended and is first-line treatment. But if you have more advanced trigger finger, or if a cortisone injection has not been successful in resolving the condition for you, surgical treatment is likely to give you a quick and good outcome. So where to from here? My office has already scheduled an appointment for you with me to discuss treatment. If you wish to have a cortisone injection, please phone or email my office to advise of this so that we can waitlist you for an earlier in-person appointment for this cortisone injection. If you wish to see a hand therapist to have a splint made to assist you in settling it down without surgery, please phone or email our office to request that we email you a list of hand therapists that you can contact to arrange an appointment. If you wish to have surgery and not to have a cortisone injection, please phone or email our office to advise that, and we'll waitlist you for an earlier appointment, which can be conducted via video consultation. Thanks for your time. I look forward to seeing you at your appointment and helping to get your hands back on track.